Hello, my diet tribe. Welcome to another video session of Let's Talk Diabetes with Nkiruka. So today we're going to be delving into type 2 diabetes remission. What do we know about type 2 diabetes remission? There's so much to be known, and there's so many myths about diabetes remission that we can demystify in this video. So sit back, relax, and enjoy. So I'll start off by saying, what do you understand by type 2 diabetes remission? In simple terms, it just means that your long-term blood sugar levels, that is the HbA1c, should fall below the diabetes diagnosis target range for a minimum of 3 months without the use of any form of diabetes medication. So no insulin use and no oral diabetes use for a minimum of 3 months. So in simple terms, your HbA1c levels should be below 48 millimole per mole or 6.5%. There's so many things that you can gain from attaining type 2 diabetes remission. Number one, you are more energetic and you will sleep well. Number two, you will be taking fewer medications. Number three, you've got reduced risk of limb amputation. Number four, you've got reduced risk of cardiovascular diseases, for example, like having a heart attack or stroke. You also have reduced risk of losing your sight, and you have reduction in weight, which has so many benefits. The causes of type 2 diabetes are actually multifactorial, and they're very, very complex. However, in most cases that we see, it is caused basically by buildup of fats in the liver and the pancreas. The pancreas and the liver are very necessary organs in maintaining the blood sugar level. So the pancreas, like we all know, produces insulin, which takes care of the blood sugar levels, and the liver stores excess glucose, which now releases it as it when the body requires glucose. So you can see that the pancreas and the liver work together to maintain the blood sugar level. But if we have fat surrounding these organs, they do not function at their optimum, and that is when we now develop the type 2 diabetes, because we now become insensitive to the insulin that that our body produces. So this makes the whole balance not well balanced. So to have the diabetes remission, we need to make sure that these two organs are devoid of any fat accumulation around them. Well, there's a common say amongst most individuals: diabetes reversal, but this is not the most acceptable terminology to describe diabetes remission. So in the medical community, we use the most acceptable terminology, which is diabetes remission rather than diabetes reversal. So that's the difference. It's just the terminology, using the right terminology to describe what we're really talking about. So that's, from my point of view, that's what the difference is. They mean the same thing, but used in the wrong context. So rather than saying diabetes reversal, you would rightly say diabetes remission. And when you're in remission, just a point of note, your diabetes has not completely gone away. You will need to keep checking your blood sugars regularly and keep close eye on things. So diabetes remission does not mean, oh, my diabetes has disappeared, which most people tend to say, oh, I don't have diabetes anymore. Most times people can be in remission for years, but it doesn't mean that the diabetes has gone. You're just doing the right things and keeping your blood sugar levels under control. So remember, remission is not a cure. There's so many possibilities that come alongside type 2 diabetes remission. And the first one, very exciting one, is weight loss. So soon after your diagnosis of type 2 diabetes, if you're overweight, if you can lose as much as 15 kilograms, then that's one of the possibilities of you going into remission. And secondly, keeping your blood sugar levels below the diabetes target ranges at most times is very, very important. And keeping your weight at a safe level. So once you lose that 15 kilograms, you have to maintain in such a way that you don't add weight, and this prevents any buildup of fat in your liver and your pancreas. Type 2 diabetes remission is actually very durable. What I would encourage you, if you've been newly diagnosed, is to work with your healthcare professional and your dietitian, and they'll put together a plan that would help you lose weight. And the protocols are quite easy to follow, so they'll all be set in place for you. So all you just need to do is be disciplined and set achievable goals and a routine that you know that you can always maintain, and compliance is key. So once again, I want to say a huge thank you for watching this video, and remember, like and subscribe. All the contents of this video are solely for educational purposes. Remember to consult with your healthcare professional if you have any questions. Thank you. Bye.